This is my fourth and final video in my series on disability and mental health. And in this video, I'm going to talk about when it might be advisable to enlist the help of others if you're having a mental health problem, what sort of help is available, and also what medications and other treatments are available and when they might be helpful. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams. I've done quite a few, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, at the outlet, I need to say that I am not a psychiatrist. I have experience in emergency medicine and family practice. I did spend 6 months total of my medical training in psychiatry, 3 months in a locked psychiatric ward and 3 months in an outpatient clinic, which is more psychiatric training than the average generalist doctor, but I am far from a psychiatric specialist. The second thing is, my previous video, I talked about things you can do on your own to improve your mental health. And all of those still apply if you're enlisting the help of others. For example, if you're seeing a psychiatrist for a mental health problem, all of the things you can do on your own, such as exercising, eating healthy, socializing, avoiding addictive substances, all apply and all should be continued. Now, I'm going to get down to brass tacks. If you have any of the following problems, you need psychiatric care. The first is if you're suicidal, and I'm going to put the suicide hotline telephone number in the description of this video below. The second is if you have strong urges to harm others. And when I was in my medical training, I always thought this was somewhat silly, as if somebody who was a murderer was going to come to a psychiatrist, until one evening I was working in my emergency department and a man checked in with a chief complaint that he felt like he was going to kill someone. And what really caught my attention was that he'd recently been released from prison after serving 12 years for murdering his wife. So you can bet I did get him admitted to a psychiatric institution, and I also gave him some credit for seeking mental health help instead of murdering a second person. The third is if you have out of control behavior that is causing significant harm, either to yourself or others. And then the fourth is if you have an addiction that you're unable to moderate or stop. Could be to alcohol, to drugs, or to behaviors, for example, like gambling. The fifth is if you're having persistent hallucinations, most commonly hearing things that aren't real or seeing things that aren't real. Any of those conditions need psychiatric help. More moderate conditions where you may need to enlist the help of another person, first of all, is if you feel overwhelmed. Your problems are so great that you can't see any way out. The second is if you feel that you're stuck. You're stuck with your problems. Everything you've tried hasn't helped, and again, you can't see any way out. The third is if you have no idea what to do about your problems. And then the fourth is if you have significant worry or sadness that's interfering significantly with your life, such as your ability to care for yourself, care for your family, interact with your friends, handle your finances, and handle your physical health. An example would be someone with severe depression who's unable to go to work, unable to fulfill their family obligations, and unable to take care of their finances. Next, I'm going to talk about where and how to get help. And I don't think everyone with serious problems needs a psychiatrist, although certainly some people do. The first thing is, if you're having a crisis, you can always go to the emergency department. You likely will not see a psychiatrist there, but emergency medicine doctors have been trained in how to handle psychiatric emergencies, such as the person who's acutely psychotic or seriously suicidal. The next is that often you can get significant help from lay people, people who aren't trained therapists or counselors. In my experience, people with problems almost always feel better if they can talk over those problems with a trusted other person. Could be family, could be friends, could be a coworker. As long as that person is on their side, wants things to get better for them. You need to be a little bit wary, because sometimes there are people who are looking to exploit those in distress. And I'm going to digress into a little story here. In medical school, in the second half of the second year, my medical school having been 4 years, you start working in the hospital. And the very first thing I did was psychiatry in the locked ward. And on the first day, I was given a patient that I was to take care of, which was a young man having their first episode of paranoid schizophrenia, a very serious mental illness. And I had no experience whatsoever. And frankly, I was very worried about whether I'd be able to help this man or not. I had to see him every day and talk with him for about an hour. I also was in charge of ordering medication for him. And to my surprise and delight, and to his delight also, he got much better in several weeks. And that was when I first got an inkling that just talking to someone, even someone not really trained as a therapist, could help people with mental illness. One thing to watch out for if you're talking to someone about your problems, whether that be a lay person or a trained therapist, is to avoid overdependence. That other person should not be taking on and handling all your problems for you, especially not in the long term. The goal is for you to be able to take on and overcome your problems. Prolonged dependency is a bad situation. The next way to enlist others to improve your mental health will probably surprise people, and that's helping less fortunate people than yourself. And most people, even with mental health challenges, can manage that. It's interesting and educational to deal with people whose problems are far more severe than your own, and makes you realize you haven't got as bad as you might imagine. Certainly my experience in medicine has taught me that. Whenever I've been feeling down or upset, I've always seen people with much, much worse problems than my own. The next level of assistance would be people who can counsel but are not trained therapists. And religious leaders, such as ministers and rabbis, fit in here. Also, self-help groups like Alcoholics Anonymous, Narcotics Anonymous, Gamblers Anonymous. Did you know that Alcoholics Anonymous has the highest success rate in getting alcoholics sober of any medical treatment? The next level is professional counselors, and this will depend on which state you live in. But in most states, counselors have to be licensed, and the people who can be licensed generally are folks with a master's in clinical social work, a doctorate in psychiatry, a medical doctor who is not a psychiatrist, and then a psychiatrist who is a medical doctor. Many people don't know the difference between psychologists and psychiatrists. A psychologist is a person who's studied mental health and mental illness and is trained in therapy, but is not a medical doctor. They cannot prescribe medication or other treatments, and they can't admit patients to the hospital. A psychiatrist is a medical doctor. They've gone through the same medical school training as any other doctor, and they can prescribe medicine and other treatments and can admit people to the hospital. And even though they may not do it on a regular basis, they know, for example, the basics of treating someone with a heart attack, or delivering a baby, or surgically removing an inflamed appendix. In fact, psychiatrists who work in a mental hospital may do quite a bit of general medical care by themselves. Now, it used to be that if you needed to see a therapist, you had to go to their office. But now, with telemedicine, you can often contact a therapist either by telephone or by video call, like Zoom or Skype. That's particularly useful for folks who live in remote areas or rural areas where there's no therapist nearby. Another useful resource is YouTube videos. There are a very large number of YouTube videos by various counselors and therapists, and many of them have very useful advice. I will warn against one thing, which is victim mentality. There are some folks on YouTube whose basic message is, you're the poor victim. All of your problems are because of other people doing mean things to you. And I don't think that's very helpful. Being a victim means that you have no agency. All your problems are due to other people. And as long as those other people keep being mean, there's no hope for you. And I think that's a very bad message to give people. Everyone is a victim sometimes. Everyone will get sick and everyone will die. But I think the best attitude is that regardless of how bad your circumstances are, there is always something you can do to improve them. My next piece of advice is, if you have a significant mental health problem, get a general medical checkup. As I stated in my previous video, people with mental health issues tend to be sickly and often have conditions that require treatment, and also there are a lot of medical conditions that can simulate a mental health problem. I gave the example of a woman who was admitted to the locked psychiatric ward because it was thought she was psychotic, but turned out to have neurosyphilis, a brain infection, and the treatment she needed was penicillin, not psychotherapy. Next, I'm going to give some brief remarks on the commonly used psychotherapeutic drugs. These are drugs that are used to treat mental illness. The first is antidepressants. And antidepressants have a couple of interesting features. The first is that they only work for some people, and we don't know why. They only work for about 1/2 of people who are depressed. The second is they take a while to have an effect, generally 2 to 4 weeks. An unfortunate thing is sometimes a depressed person will be prescribed an antidepressant, take it for 3 or 4 days, not notice any improvement, and stop the medication. That's too early. If you are prescribed an antidepressant and take it for 2 to 4 weeks and see no improvement, you should try a different class of antidepressant. There are quite a few, and I would suggest you try at least 3 classes before deciding that antidepressants won't help you. The second class of psychotherapeutic drugs is lithium. Lithium is a salt, and it only works for bipolar illness, manic depression, and we don't know why it works, but it tends to work really, really well. Lithium does have some risks, and you need regular blood tests while you're taking it, but if you have manic depression, you should definitely try lithium. The third group are minor tranquilizers. These are generally barbiturates, which are rarely used today because they're extremely dangerous in overdose. Benzodiazepines, such as Xanax and Valium, and GABA modulators, such as Ambien. All of these drugs are what are colloquially known as downers. They sedate or calm people. The big problem is they're all quite addictive, and Xanax is extremely addictive and very hard to get off and somewhat dangerous to get off once you become addicted. If you need a tranquilizer, I would strongly suggest you consider something other than Xanax. There are 2 drugs that have a tranquilizing effect that are non-addictive. One is hydroxyzine, which is an antihistamine like Benadryl, but the most sedating antihistamine. The other is trazodone, an antidepressant that's also fairly strongly sedating. And these drugs have 0 risk of addiction. Then there is another category of drugs which really doesn't have a good name that really describes what they do. They are called major tranquilizers, even though some of them don't have much of a tranquilizing effect, and antipsychotics, even though some of them help people who are not psychotic. They're classified as typical, such as chlorpromazine, and atypical, such as quetiapine. Today, mostly the atypical drugs are used because they have much less severe side effects than the typical drugs, although both are about equally effective for treating the mental illness. These drugs are very helpful in people with psychosis, what lay people would call insane. Some of them are also quite helpful in bipolar illness, manic depression, and some of them have been proven helpful in severe depression as well. You don't have to be psychotic to benefit from an antipsychotic drug, and I wish the name would be changed to something that more clearly reflected how they helped. The next category of drugs is anticonvulsants. These drugs were invented to be used for people with seizure disorder, brainstorms, where the brain's activity is out of control. And some of them have been proven to be helpful in folks with mental illness. For example, lamotrigine, brand name Lamictal, has been proven to be helpful in some folks with manic depression and some folks with severe depression. Now, if you need them, how do you get a prescription for psychotherapeutic drugs? Well, that's not a problem if you're seeing a psychiatrist, but most people with mental health problems are not seeing a psychiatrist. If, for example, you're seeing your minister or a psychologist, they may recommend that you see your primary care doctor, your family practice doctor, or internist. And primary care doctors have a lot of experience in prescribing psychotherapeutic medication. You don't necessarily need a prescription from a psychiatrist, although if you have a complicated problem or severe problem, again, you're probably best off seeing a psychiatrist. Finally, I'm going to talk about non-medication treatments for severe depression. And here we're talking about very severe depression or people who are very severely suicidal. The first is electroconvulsive therapy, what's popularly called shock therapy. And here I really have to object to the movie One Flew Over the Cuckoo's Nest, which has permanently created a horror of electroconvulsive therapy in the general public, which is totally unfounded. In the movie, the patient is given the shock therapy while awake, and this simply isn't done. If you're going to get shock therapy, you're given a general anesthetic first. You're asleep, and then you get a mild shock to the head, which causes a convulsive seizure, an epileptic seizure. And the seizure lasts a few minutes and goes away, and then you wake up. It's totally painless. There is only one significant side effect, which is that people tend to have a hazy memory for about the 3 months prior to the shock therapy. Often people will need more than one treatment. I want to describe a case that I saw myself that shows how wonderful this treatment could be. A woman was admitted to the psychiatric ward for severe depression. She stayed in her room and would not leave for any of the group activities. When any medical personnel came in her room, she would sob uncontrollably and couldn't talk, so no therapy could be done. We gave her the maximum doses of antidepressants for 4 weeks, and there was no effect. She was still isolated in her room and would cry uncontrollably if anyone came near her. So it was decided to initiate electroconvulsive therapy. The day after the first shock, she was smiling, walking around the ward, participating in group activities, and could speak with her therapist. It was truly miraculous. A more recent treatment for severe depression is ketamine. Ketamine is a general anesthetic. It was invented to put people to sleep for surgery. And for some reason, we don't know why, it has a strong antidepressant effect that's pretty rapid, just like electroconvulsive therapy. It can be given intravenously or by inhaling it through a spray in the nose. You cannot take it in pill form because the digestive system degrades it and renders it inactive. The one issue is that ketamine is highly addictive. Finally, for the most severe mental health problems, admission to the hospital to a mental health ward may be the best treatment. And in all 50 states, there are legal methods where a person can be admitted involuntarily against their will if it really seems necessary. In the state in which I live, I can have a patient involuntarily admitted to a psychiatric facility, and the patient can be observed there for 3 days. After 3 days, they have to have had an evaluation by a psychiatrist, and then the psychiatrist has to go through further paperwork if they feel that the patient needs to be held in the psychiatric ward longer. Let me give an example of an actual patient that I saw a long time ago when I was practicing in a small rural hospital in Canada. Two policeman brought a young woman in for me to evaluate. And the story was she'd been standing on a little hill, urging everyone who came by to join her on the hill because Jesus Christ was going to appear on the hill with her. The real issue was that this was in the winter, the outdoor temperature was 20 degrees, and the young woman was stark naked. If she'd stayed out long enough, she would have frozen to death. And that was no joke, because where I lived in Canada, every winter some people did freeze to death. She was psychotic and didn't understand the gravity of her situation, and I had her admitted to a psychiatric institution. However, I was able to persuade her to go voluntarily. And for people in this situation, and if you're ever in this situation, here's what I tell them. I tell them, my job is to look after you, and I don't think it's safe for you to leave the hospital now. Therefore, if you insist on leaving, I'm going to fill out the paperwork to have you kept here, and if necessary, I will call the police and they will ensure that you stay here. However, it will be much easier for you and the medical staff if you agree to stay voluntarily. And when I spell it out for them and explain it's not a punishment, it's because I want them to get better, I've found that about 9 out of 10 patients will agree to stay in the hospital voluntarily. And that can be a big advantage. For example, if you ever need a security clearance, you're not going to get one if you ever had an involuntary psychiatric admission. Finally, something that many people do not know is that if you're having a medical emergency, and that includes psychiatric emergencies such as being seriously suicidal, you can go to any hospital and the hospital is obliged to give you an emergency assessment and then treat you to the best of their ability. And if they don't have the ability to treat you, for example, if they don't have a mental health ward, to transfer you to a hospital that can, regardless of your ability to pay. This was made law as part of the Comprehensive Omnibus Budget Reconciliation Act of 1986, and the medical part was called the Emergency Medical Treatment and Active Labor Act, and hospitals have to follow this law. I actually practiced emergency medicine before the law was passed, and I distinctly remember having a 21-year-old man who was bleeding to death in the emergency room and required emergency surgery, and the hospital administrator tried to get me to transfer him to another hospital, and I knew that he wouldn't survive the transfer. And at that time, that was legal. It no longer is. Luckily, I was able to enlist the help of a surgeon who read the hospital administrator the Riot Act, got the operating room opened, and operated and saved a man's life. So if you're having a mental health emergency, you can always go to the hospital, even if you have no way to pay, and they will have to get you treated. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.